Dear participants, please take your seats. The panel discussion is going to start shortly.
Dear participants, ladies and gentlemen, can I indeed ask the colleagues that want to attend the second panel of our Baku Forum, the second also of today, to join us and to take a seat. I would like, in the interest of the agenda, sticking as good as possible to the agenda in terms of timing, I would indeed like to start the afternoon session. And I think it's a matter of fact that we are privileged to address the theme of the second panel with an excellent guest that will introduce the theme. So this morning, more or less, we had the introductory sessions with statements, and then we had the first panel under the leadership of Eka about, let's say, the general landscape seen from different parts of the globe, or some parts of the globe. This panel, panel 2, is addressing, and I quote, reimagining multilateralism for a multipolar world. And we will have a panel that will discuss how we could indeed try to rebuild, re-strengthen multilateralism in the multipolar world. But as you've seen on the agenda, we have the opportunity to first dive into the substance with a expert, a witness since 2017 at the helm of WHO, but before taking up that responsibility with quite a vast experience both in health but also in active politics at the national level. If I'm not mistaken, Dr. Tedros, you were subsequently Minister for Health and then also Minister for Foreign Affairs. So you're a technical expert in the field where you are now at the helm of the World Organization, part of the UN system. You have a lot of expertise and practice at the national level, and then since 2017 leading a multilateral organization on a daily basis, and not just a multilateral organization, but one that is at the core, I think, of all the concerns of the citizens of the globe, especially since COVID-19, which was one of the major challenges, together with Ebola and some others, that you successfully addressed. So with no further delay, I will give you the floor for your introductory remarks on how you've been living through, let's say, the most recent events with the particular position that the United States is now taking. And we are very keen to hear from you how you assess the current situation and how you see it evolving over the next period of time. Please, you have the floor, and thank you very much for being there.
Thank you very much. So for the introductory, shall I do it from here or from there?
Yes, as you want.
Yeah? Okay, so the introductory I will, and then for the questions I will come back. Thank you, former Prime Minister Leterme, Excellencies, dear colleagues and friends. Good afternoon, and my thanks to NGIC for the invitation and for its hospitality. As I said in my remarks this morning, multilateralism is never easy, but there is, frankly, no alternative. Isolationism is a dangerous dead end, and bilateral interventions, while important, only go so far. The only way to truly address shared threats is through shared solutions. As I also said this morning, I believe that the proposed withdrawal of the United States from the World Health Organization is a lose-lose-lose. It's bad for WHO, it's bad for the world, and it's also bad for the United States. But of course, WHO is not the only agency affected. The US accounted for 30% of all overseas development assistance. So the sudden disruption to that funding is having a huge impact on health and humanitarian work around the world in many countries. For example, The suspension of funding to PEPFAR, the President's emergency plan for AIDS relief, caused an immediate stop to HIV treatment, testing and prevention services in more than 50 countries that PEPFAR supports. 8 countries now have substantial disruptions to antiretroviral therapy. Eswatini and Ethiopia will run out of HIV drugs within 3 months, while Brazil, Haiti, and Ukraine have less than 6 months' supply. On malaria, we have seen severe disruptions to the distribution of insecticide-treated bed nets due to stockouts, delayed delivery, or lack of funding. In Africa, all indoor spraying campaigns have been put on hold, and only Uganda and Kenya were able to resume spraying the targeted households. On tuberculosis, 14 countries in Africa and Asia are facing crippling breakdowns in their response, with shortages of human resources, disruptions to diagnosis and treatment, data and surveillance systems collapsing, the vital community engagement work deteriorating, including active case finding, screening, and contact tracing. 6 countries have reported failing procurement and supply chains for TB drugs, jeopardizing the lives of people with TB. On immunization, WHO's network of more than 700 laboratories for detecting outbreaks of measles and rubella faces imminent shutdown, increasing the risk of local outbreaks, global spread, and avoidable deaths. The sudden suspension of US funding and the sudden disengagement of US institutions is also affecting global efforts to eradicate polio and the response to mpox epidemics in Africa. Apart from the impact on these specific programs, US funding cuts are also affecting the response to humanitarian crisis. Almost 24 million of the most vulnerable people are at risk of not being able to access essential health services, including for mental health, gender-based violence, and sexual and reproductive health. More than 2,600 health facilities in 12 humanitarian settings have already suspended services, at least partially, or will do very soon. In Haiti, staff have been laid off, salaries have been cut, drug stocks are running out, and laboratory operations have been disrupted, jeopardizing the ability to monitor and respond to threats including HIV and malaria. In Ethiopia, the abrupt loss of US funding threatens to reverse progress in disease control, immunization rates, maternal and child health, and emergency preparedness. In Cox's Bazar in Bangladesh, the largest refugee camp in the world, diagnosis and treatment of hepatitis C has been disrupted, as well as disease surveillance, primary and secondary health care for refugees, laboratory services, procurement of supplies, and salaries of health workers. What is the result of all these disruptions? And that's the question. If these disruptions continue, we could see an additional 15 million cases of malaria and 107,000 deaths this year alone, and more than 10 million additional cases of HIV and 3 million HIV-related deaths. All of these impacts are avoidable. For the moment, these numbers are projected, not real, but they could become real very quickly. We ask the US to consider continuing its funding, at least until solutions can be found so life-saving services can be sustained. And we continue to ask other partners to step up. The world's most vulnerable people are continuing on us or counting on us. So I thank you.
Thank you. Thank you. Thank you for these remarks. Maybe following up on the new American administration and its view on the present and future of WHO, if I confront you with some critical remarks by the Trump administration, we're talking about suspicions of mishandling of COVID-19, which was of the Trump 1 administration time. It's about unduly influenced by some member states. It's about the need for reforms of the multilateral system, including WHO, and it's often referred to a disproportionately big contribution by the United States compared to other member states, where you partly already pointed at these problems. But how do you address these suspicions as phrased by President Trump?
Yeah, thank you. No, thank you. Thank you so much. These are, this is a very important question. When I heard about the withdrawal of the notice from the US to withdraw from the World Health Organization, I was in Tanzania. There was Marburg outbreak in Tanzania, so I went to Tanzania to help. And it was actually, the announcement was made after the president of Tanzania announced the Marburg outbreak in Tanzania. So the following day, I heard about this news. And by the way, the Marburg outbreak, which started a few weeks ago, has now been under control. So there was an announcement that the outbreak was declared over. But the reason I'm starting with this is the kind of work that WHO does, meaning helping countries to control outbreaks. Of course, to prevent outbreaks, but if they happen, like we did with Marburg, to detect it early and stop or manage the outbreak. And the resources that come from the US finances our emergency response. So the issue is, if the emergency response, the emergency capacity we have in WHO because of financial problems is compromised, we may not be able to manage outbreaks like we did now, which was declared over today, like Marburg, Marburg means the cousin of Ebola. And that means if outbreaks cannot be contained wherever they happen, the disease could go to the US. That's as clear as. You remember in 2014 from West Africa, Ebola cases made it to the US. So that's why I said earlier, it's a lose-lose, because WHO will lose, the emergency response will be weakened, and the world will lose, and the US will lose, because the disease cannot be controlled as soon as possible. So that's one of the impacts. Then coming to the executive order I read while I was in Tanzania has 4 issues. One, about reform. Second is about payment, disproportionate payment that the US says pays. And third is about mismanagement of COVID. And fourth is about undue influence by some entities. I will explain one by one why these 4 reasons are actually good reasons to stay, for the US to stay in WHO than leave. Number 1, reform. If the US is interested in reform, it's welcome, because we're open to reform. That's why we have been doing our reform since 2017, more than 90 reform initiatives, the largest in the history of the organization, which is really changing the organization significantly in terms of efficiency, effectiveness, and so on. So if reform is the issue, welcome. There is no reason, it's not a good reason to leave. And then the second is on payments. In 2017, when we started our reform, in our analysis, we identified dependency of the World Health Organization on traditional donors as a major risk. And we have agreed then in our management to broaden the donor base. That means what the US wants to pay less, WHO also wants. Because we don't want to depend on few donors, traditional donors. We want to get our resources, revenue from broader donor base. If we're the same on this issue, then US, instead of leaving, should stay to help us succeed in broadening the donor base. Then in the long term, not only US, other traditional donors will also pay less. So if we want the same thing, then I don't think it's a good reason to leave. The third, on COVID management, we did our best, of course, and we even identified the major weaknesses. We have already started changing things based on the lessons learned. So that cannot be a good reason. Actually, if there is more to do, it's better to stay and help. Then the fourth is undue influence by some entities. As far as WHO is concerned, when there are issues that contradict our values and principles, we always say no respectfully. We say no because of, the same reason I told you to President Trump. This is during the first term. We said no to Russia because of our report on Ukraine, which they didn't like. We said no to China because China doesn't agree with our position on origins, especially what we say, all hypotheses on the table, including lab leak. This is a very principled position. So when the answer is no, we say no. If that's what the US wants, that's what we're doing. So this cannot be a reason to leave. So these are the four issues. And what we're doing now is three issues to address this. One, since we're losing a lot of funding from the US, almost 20% of the budget, we're tightening our belt and reducing our expenditure and reprioritizing. The second is we're trying to mobilize resources using the instruments we have. And the third is we continue to engage the US to show that being a member of WHO actually benefits the US and to convince them to reconsider. So these are the three things we're focused now. Tighten the belt, mobilize resources, and engage the US. And I hope this thing will change. And thank you so much for this very important question.
Thank you. Only one question more, because I know you have an urgent appointment with the President. But just in a couple of minutes, if you look at the general landscape of the multilateral cooperation, with your experience of the past 7-8 years, given the antagonism you witness now and knowing, let's say, how the engine functions from inside, what is the kind of recommendations you would give to policymakers and to member states to let's say, re-strengthen the multilateral system?
Thank you, I'll be around. Thank you so much. Thank you.